A very good evening all. I am Deena Gupta with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 103 million cases of COVID-19 with more than 2 million deaths. In the United States, we are at 26.5 million coronavirus cases with at least 447,000 deaths. For nearly a month, the nation has averaged at least 3,000 deaths per day. Experts are also worried about the new variants of the virus which have been spreading across the country. Today, nation's leading health expert Dr. Anthony Fauci on the new variants said that the United States isn't vaccinating enough people fast enough to stay ahead of the new variants. So it's essential to speed up the vaccination program in order to curb the spread of these variants. Dr. Anthony Fauci also stated that at least 70% of the population needs to be fully vaccinated against COVID-19 before going back to a sense of normalcy. So again, we want to remind you all about social distancing, hand washing, and wearing a mask. If you are a medical professional on the front line of the coronavirus pandemic, please email us on events@itvgold.com with your experience and advice. Meanwhile, in politics, Democrats are moving fast track on the $1.9 trillion COVID relief package, which was presented by the President Joe Biden. On former President Trump's impeachment, House impeachment managers argued if former President Trump was singularly responsible for inciting the U.S. Capitol attack. Former President's legal team has claimed a Senate conviction would be unconstitutional. So how does all of this impact us, and what should we now know about COVID-19 at this point? We speak tonight with doctors, politicians, and community leaders. Here are the headlines. Dr. Deena Gupta-Adimoolam discusses coronavirus updates and vaccine in New York City. Former Mayor Sadaf Jaffer addresses coronavirus pandemic's impact and measures Montgomery Township, New Jersey. Inspiring South Asian American Women presents virtual program on vaccination in New Jersey. A lot more on the other side of the break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Deena Gupta, and this is Vision of Asia, Wednesday night episode of South Asian News. Let's take a look at the coronavirus updates and measures. More than 26.5 million coronavirus cases with at least 447,000 deaths are here in this nation. U.S. Centers for Disease Control and Prevention, the CDC, has projected more than a total of 534,000 by February 27th. New COVID-19 cases and hospitalizations appear to be on a downward trajectory in the nation as the Biden administration remains confident that it can hit its target of 100 million vaccines in 100 days. The nation has so far distributed almost 60 million COVID-19 vaccines, and out of those, nearly 34 million vaccines have been administered. Dr. Walensky, the director of CDC, however, has warned that the new COVID-19 variants of the infection popping up across the country could threaten that positive momentum. On these various nation's top infectious disease expert Dr. Anthony Fauci said that the people are protected from infection by public health measures the less opportunity you give to the virus to mutate. He also added Americans should continue to follow social distancing guidelines and added that there is no harm if people want to double mask for added protection. On this and much more, we spoke to expert Dr. Deena Gupta-Adimoolam. Here is Dr. Deena Gupta-Adimoolam. There are about 26.4 million cases in the U.S. right now with more than 446,000 deaths. They are saying, however, the trend is going down. The cases are going down. My question to you is, how are you observing these numbers, and are we on the right track of going down?
So definitely it looks like the cases are going down, and that's because of that surge that initially happened after the holidays. After we had Christmas and New Year's, we noticed there was a surge in cases as people were coming together in their homes or with others in social gatherings, and there was a spike, and now we're seeing the end of that surge.
Right. What do you think was the biggest reason behind that surge, doctor? And today a study came out saying that young adults from the age of 26 to 49 could be responsible for the amount of surge we saw. What is your comment?
So I think from the information that we have from the CDC as well as some of our health experts, we know that some of these increased cases have come in as a result of some of these smaller gatherings that people tend to think may not necessarily be so bad. They think that they're safe because there's only maybe 10 people in their home, but in fact, these are the causes for why we're seeing some of these surges and increased transmission throughout.
We are seeing about 3,000 deaths per day. How do we understand that?
So as we see more and more cases of COVID, there's of course going to be a potential for an increase in deaths related to COVID as well. The good thing is the death rate isn't anywhere close to what it was when this pandemic first started. And that's due to us understanding more about this virus, about the transmission of this virus, and having more options available to patients in the hospital.
Definitely. Let's now talk about the COVID-19 hotspots, doctor. There are various hotspots across the country. Hopefully and thankfully, New York is not one right now. What should these hotspots be doing, according to you?
So really the same thing we've been talking about since the beginning of this pandemic. We know that social distancing measures, they work. We know that they work to help decrease the spread of COVID-19. So hand washing, staying home when you're sick, wearing a mask, all of those things are extremely important to be doing at all times during this pandemic.
Right. And let's talk about the restaurants real quick, doctor, because today the news came out where New York City will reopen their indoor dining starting February 14th. My question to you is, we were once the epicenter of this disease. Do you see that as a safe thing to do? And also, could we potentially be an epicenter again?
So, when we look at indoor dining, that was a cause for some of these increased cases of COVID-19 during the pandemic. So, of course, there is a risk that's associated with indoor dining, though that risk may be lower now than it was previously. So I think that our government is doing the best that it can in terms of trying to make these reopening of restaurants and rather indoor dining be made in the safest way possible. So they're trying to maintain social distancing, they're trying to maintain improvement in air circulation, but nonetheless, it is not zero risk to go out to a restaurant and indoor dine. So I think it's really important to think about your risk. For somebody who may be high risk of having COVID and maybe having hospitalizations or severe COVID, if they do contract the illness, they probably should consider avoiding indoor dining at this time. But for other people that might be lower risk, they can think about it in a different way, but they still need to try to be as safe as possible.
And those guidelines are so important. I just have a quick follow-up question with the guidelines. Dr. Anthony Fauci has said that double masking is not harmful, could add a protective layer. What is your comment on that?
So we know that one mask can potentially protect us from COVID-19. So the thought is that wearing two masks might be even more protective. There's no great research or studies that really justify those findings. It just seems to be common sense. So if you have the means of being able to wear two masks at a given time, that might help protect you even further by decreasing the likelihood of either transmitting the virus through the mask or coming in touch with the virus from respiratory droplets from the outside.
There's a lot of questions out there about the vaccines, they're working and how important they are. Tell me about the fact that why the vaccine rollout is so slow. What have you seen in the medical community? What are you hearing about this slow rollout?
So I think one of the major issues related to the rollout has to do with supply. So we knew that even before the vaccination rollout process began, that right now, unfortunately, the supply of vaccinations that we have from the two major suppliers, Moderna and Pfizer, just can't keep up with the needs and the demand of the population. So we know that even from CDC data, looking at the population that was in phase 1 and phase 1A and phase 1B rather, that was going to be close to almost 80 million people. And we know as of data from the beginning of February that roughly about maybe 24 million or so Americans have received the COVID vaccine thus far. So there's a large number of people within even just our phase 1A and 1B population that have not yet received the vaccine. And that's just because we don't have enough of the vaccine to go around. As you know, Aditi, we have each vaccination requires 2 doses. So even if we have 100 million vaccines available, that means that we can only really vaccinate 15 million people. So we need to somehow rev up supply, and there has been some positive light in relation to that. The thought is that Pfizer and Moderna have told us that maybe they'll be able to secure up to 200 to 400 million additional doses as of June of this year. But unfortunately, that's more time. It's not going to happen tomorrow. So what's important is that we all do the right thing by trying to maintain our distance from each other, try to wear our mask, wash hands, and stay home when possible.
Let's now take a look at ISAW Inspiring South Asian American Women in New Jersey. ISAW was founded by a dozen women from across the state, each with unique South Asian American experience, and seeks to bring other South Asian American women together to promote community engagement and public service in New Jersey. There's a huge disparity in equal representation on boards and commissions, and there is a greater disparity when looking at how South Asian American women occupy or are considered for these positions. ISAW aspires to serve as the bridge and support network for advancement of South Asian American women in public service. Recently, ISAW hosted a virtual panel on getting New Jersey vaccinated. Here is the story.
Perhaps if I could just start with Dr. Adinaro, because I know you've been dealing with this on a daily basis, to just speak a little bit about the common side effects that people should have when they get the vaccine. A lot of people just want to know, is it going to make me sick, and how am I going to feel when I'm done?
Sure, and just want to say good evening, everybody, and appreciate being invited to come join you all. Most of what we're seeing as common side effects are localized. It's pain at the site of the injection, arm pain. We do have some people who report some other symptoms, including fatigue and body aches. There's some evidence that the booster dose, so the second dose, will create a few more of these side effects, which are really just the immune response that the vaccine is generating in your body. And we've had very few cases of serious reactions. Most of them being around an allergic reaction or something along those lines. They have been incredibly rare, and most of the more serious ones being on the order of fewer than one per 1,000 or even 10,000 injections so far in New Jersey.
So I think that's all very good news, and should, I hope, make people feel better about being confident to get the vaccine. I'm wondering, Dr. Murthy, if you would like to speak at all to within the South Asian community, are there particular concerns either towards the vaccine, a specific vaccine itself, or vaccines in general, that we should be addressing and working to break down barriers?
South Asians in particular, there's a lot of confusion because data that's coming from India and that region looks like maybe mortality is low or, compared to other population. That is not always what we are seeing in the data coming from UK and other big national healthcare systems where, close to 100 million people are studied. So what we have to know is we do need to consider ourselves to be high-risk population for various reasons. One, obesity is not diagnosed at the right level for the South Asians because our cutoffs are very different. So many people who are obese are not aware that they are obese or overweight, or diabetes diagnosis, hypertension diagnosis has happened because people aren't getting routinely screened for these diseases. So South Asians are at risk at an earlier age, at an earlier weight, at a lower weight compared to other population. So not considering that and worrying about the side effects of vaccine, whereas not considering the seriousness of the illness is not wise, right? If you talk to your own doctors, and if you talk to all the doctors in New Jersey, I don't know many doctors who are not taking their vaccination. Why are they all open to taking the vaccination? We have to ask, because they have seen the difficulties in the hospital, and every single day we have supported multiple members of multiple South Asian families to be in various parts of the hospital with various levels of complications. We are not trying to cure COVID-19, but we don't want you all to end up in the hospital. We don't want you to all have complications. So this is a way to address COVID-19 with the most possible solutions we have right now. It's not perfect, but we need to be open to it. We need to do whatever we know right now, whatever is accessible to us to prevent it. And ideal solutions or optimal solutions will come. Right now, not having a lot of doubts, fears, anxieties about well-researched vaccines is important. And to be open to taking it and taking it promptly when it's available to you, and not nitpicking about Pfizer versus Moderna. What is the minor side effect profile difference? Should I wait for J&J vaccine and so on? Isn't wise. Again, what's available to you locally, easily, is well researched, and just follow the direction that the state is giving us.
I had a couple of questions for you, but let me just first start with this issue of communication and talking to people and kind of, we at the state realize that we have a certain responsibility to provide information, but sometimes the more local you get, the better the information is received. So I think a two-part question for you is, what do you hear and see in Middlesex of questions that are coming up? And what is Middlesex County, as an example, doing to help facilitate the vaccine program? Because we know the counties are very engaged and involved in this.
Until January 21st, Middlesex County had its own registration site. Many of the counties did. But as of January 22nd, we transitioned to the state site. We made a decision because the infrastructure, assuming we are going to get more vaccine dosages, the infrastructure we really feel strongly it has to be coalesced into one system to make everything move, fairly and efficiently. So there's these two overarching issues: getting it distributed throughout the state fairly and efficiently. And so right now, if you were to go to the Middlesex County site, and we've made it very clear, we have areas, it's COVID-19, you go to that page, and we have testing links because we're still testing all over the county. We have multiple sites where people can come get tested, and we have mobile units. So that's still going on while we're also trying to get the vaccine out to people. So when you come onto our site now, if you are trying to register for the actual vaccine, there's a link and it takes you to the state site. One of the things we've made a commitment to in Middlesex is right now, if there's still issues while they're working out the bugs on the state site, and also because we're aware there are people who don't have access to the technology, right? They don't have cell phones, or they don't have computers, or they're not savvy with them. There are a lot of our members of our senior population who aren't really good at this stuff. Not everybody has, grandkids at the ready to get their grandparents through the sites. So we made a commitment in Middlesex County, and I know a number of other counties have done this as well, since I've been in touch with county commissioners from different parts of the state. There's a number that you can call into to Middlesex County's health department. And we have that being manned 9 to 4, I'll say 9 to 4 or 8:30 to 4, 8:30 to 4. You can call in and ask questions, but if you also need help registering, there will be someone on the other line who will do that with you, who will walk you through that. And if you don't have the computer, they will be on a computer and they will register you. So that's a commitment we've made. Another big question we've had recently is people who are concerned because they might have gotten the first dose in a Middlesex local site. Because as Deborah mentioned, there are 6 mega sites, and one of the mega sites happens to be in Middlesex at Raritan Center in Edison. That's a fully state-run site. But Middlesex County, like many of the counties, we have separate sites throughout the county. We have the capacity to operate 6 simultaneously. We have not been doing that yet because we don't have enough vaccine. So we've taken different periods of time. In 1 week, we might open a center in Piscataway for several days. This past week, we opened one in East Brunswick for the first time.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Deena Gupta-Adimoolam and this is Vision of Asia South Asian News segment. Now we have a conversation with former Mayor Sadat Jaffer from Montgomery Township in New Jersey. She is the first South Asian woman to have served as a mayor in the state of New Jersey and the first Muslim woman to have served as a mayor in the United States. She's also a postdoctoral research associate at the Princeton Institute for International and Regional Studies. Talking to us much about the coronavirus pandemic, former Mayor Jaffer reflected on issues dealing with the economic and healthcare ramifications of COVID-19, vaccine distribution, food insecurity, and the hybrid school system in the Montgomery Township. Addressing what's needed in her township, Mayor Jaffer spoke on the need to speed up vaccination program with the national plan along with federal government's help in small businesses and vaccination of teachers to safely return back to school. She appealed to everyone, asking them to stay vigilant and fight the COVID fatigue and follow CDC guidelines, especially wearing a mask. Here is a segment of our conversation with former Mayor Sadat Jaffer of Montgomery Township. So let's start this interview just discussing the cases and deaths your township is seeing currently. Are you seeing a downward trend as we're seeing across many states in this country?
Definitely. Yeah, it was quite high around December, end of December, January. The numbers were quite high, but we have seen a decline in rates of infection. And I think it definitely has to do with the numbers of people who are getting vaccinated against COVID-19.
Yes, definitely. Let's talk about the hospitals, Mayor. What is the condition of hospitals in your township? And, the following question is, if the surge was to get bad, are you all prepared with your PPE, ICU beds, and ventilators?
I believe that New Jersey is prepared. I mean, it is difficult to see, especially healthcare professionals and doctors succumbing to the virus after treating it for so long. But thankfully, the levels have not been very high lately. I know that there's a lot of concern over the new strains that are more infectious and the impact that might have. But I do believe that we will be as prepared as we can be for the wave.
Let's go into more about science here. Vaccines, these are being talked about everywhere in this country right now. There is a shortage of supply of the vaccine. What is happening in your township and in New Jersey, if you can give us an insight into it?
Well, the vaccines are distributed from the federal government, and unfortunately, there just wasn't the stockpile that the states expected and were told was coming. And so now it really is up to the new federal administration to try to produce as many vaccines as possible and to distribute them to the states. So the infrastructure in New Jersey is ready to distribute those vaccines. It's just that we don't have the supply coming in yet.
What changes do you think the new administration needs to make to distribute this vaccine rollout faster? Because we need about 70% of the population vaccinated to really fight this disease.
I think that part of it is just managing expectations. I think that it's a huge undertaking to vaccinate 70 to 80% of the entire population, and it's not going to happen overnight. I do think that we need clarity from the federal government as to how long this is going to take, but also that letting us know what they're doing to make sure that they're producing as much as possible of the vaccine to get it to us all as fast as they can.
And this pandemic has been disproportionately impacting Black and Brown communities. We've talked about this before on the show. When you look at the vaccine rollout, are you seeing the same trend?
Absolutely. On the one hand, there is a hesitance on the part of some minority communities to be vaccinated because of the history of, very deserved distrust of the medical establishment. But then on the other hand, it just is the case that wealthier communities, and those tend to be whiter populations, tend to be getting access to the vaccine more easily. So we need to make sure that there is an equitable distribution of the vaccine throughout the country, but I don't think we've accomplished that goal yet.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Deena Gupta-Adimoolam. Take care.